Hi there, and welcome back to Cypress Wellness Collective channel. In today's video, we're going to focus on phase 2 of family-based treatment and eating disorder recovery for teens and children going through eating disorders and their loved ones supporting their recovery. My name's Erica Bent. I'm a licensed therapist and eating disorder specialist. And if you haven't already watched the former videos that I created on family-based treatment, phase 1, and preparing for phase 2, then go back and watch those first, as this video will make a lot more sense. Without further ado, let's jump into today's talk. So, phase 2 of family-based treatment is typically going to happen once we've met all of the goals of phase 1, which makes sense, of course. Initially, we want to make sure that your teen is ready for phase 2. So they should be medically stable. They should be experiencing a significant reduction in eating disorder behaviors. They're not fully recovered. They may still have thoughts and urges. They may still have some behaviors. But overall, we're seeing a significant improvement in how they're relating to food, how their psychological experience is. We're seeing much less distress, more workability. And we trust that they're able to take over some autonomy and independence. The main goal of phase 2 is a gradual transition of moving parents away from the directive role in recovery and allowing their teen to step forward and take that directive role. So we transition control from parents over to the teen, and we want to increase their autonomy and their independence overall without having setbacks or relapse. Now, phase 2 is ambiguous, and some families will say that it's much more challenging than phase 1. In phase 1, you have a clear directive of parents are in charge, they're making decisions around food, they're supporting meals getting completed, and it's rather black and white. It's actually a quite rigid approach to treating a rigid eating disorder. Meals need to be completed. If they're not, there's some kind of concern or consequence, staying at the table longer or not being able to do their sport, so on and so forth. It's a behavior modification approach to making sure that your teen is getting the nutrition they need to promote recovery. When we get to phase 2, there's a lot more ambiguity. One, about readiness for phase 2, but then on every step along the way, because we don't have 100% insight into how your teen is navigating eating disorder thoughts or urges internally. We see behaviors, but the more you offer opportunity, the more an eating disorder might show up. And so we want to navigate these questions every step of the way. Parents often struggle to determine when their teen is ready to begin. Teens may send mixed signals. They may beg for freedom to eat out with their friends, for example, and yet they may be unable to take a bite of food that isn't required. Right? So they're not eating spontaneously yet. They may still be struggling with many thoughts and urges, but these fears of continued loss of freedom, or perhaps they're protecting the eating disorder and want to go back to it when there's opportunity, it's hard to know what might be going on for your teen. And so these are the decisions that parents and clinicians have to make to discern, is your teen ready for that next step? If we offer some form of freedom, are they capable of challenging their eating disorder thoughts and urges and still doing what they need to do to stay in recovery? Or if we give them this opportunity for freedom, is it a moment where the eating disorder is really going to take advantage? And you need to discern the difference of readiness. Now, some parents might be too trusting and give autonomy too quickly, and other parents might be too untrusting and not give autonomy. And either extreme is not good for recovery. In the one extreme where you give autonomy too quickly, it's an opportunity for the eating disorder to take advantage, and that could be a significant step back in recovery. If your teen's not ready to challenge eating disorder behaviors, maybe they're not strong enough in their coping ability, or discernment of even recognizing that it's the eating disorder and they're over aligned with it without noticing it. Those are skills that they need to develop before they're ready. And if a setback happens, oftentimes once we've made some progress in recovery and then we experience a setback, the eating disorder is often louder than it was before. It's stronger than before. And so we really want to prevent those opportunities from happening. Now, in the other extreme, where parents are more untrusting, maybe they typically do a phenomenal job with FBT because they're taking it very seriously. But once we get to phase 2, they're still holding on very tightly and having a really hard time allowing their teen to have some kind of autonomy and trusting their capability. And in this extreme, it's very hard for teens because they're still their teenager wanting freedom and independence developmentally that's appropriate. And they may burn out on that desire to experience trust. They may say, well, my parents are never going to trust me with this, so what's the point? Why am I working so hard? I give up. And the moment they let off the gas in their own recovery, eating disorders will take advantage of that vulnerability. So we want to find the middle ground. We want to be balanced when it comes to understanding these ambiguities, tolerating some level of uncertainty, but still having our foot on the gas in supervision and monitoring and discerning where the eating disorder might be showing up and still having some semblance of control around that. So let's talk about this more strategically. We're going to be navigating to the transition of control and meals and snacks over to your teen. We recommend taking a conservative approach because it's better to be conservative and be slow rather than letting off the gas too quickly and it causing that relapse, which then is harder to come back from. But not so conservative, of course. And we're going to reassess often through every step of the way. So transition of autonomy might look like this. Initially, your teen might begin to choose 2 to 3 options given by you for one meal or one snack. For example, would you like a turkey sandwich or a peanut butter and jelly sandwich for lunch? Okay, it's not a lot of option here, but we're just starting to understand what's their decision-making capability. Is the eating disorder showing up in any of their decisions? Are they always choosing a safe food? Are they always choosing a food that's under a lower calorie item? Are they presenting really anxious and struggling to make a decision? What's going on with your teen? So pay attention to these new opportunities every step of the way. The next step might be begin to choose one snack per day and play with your supervision. So for example, your teen can choose what they would like for their night snack, and you are observing their choice and their plating of the meal. So now it's not just how are they thinking about food, but are they able to portion adequately? Do they know their meal plan? Because they need to now be the ones to uphold it, and you need to trust that they know that. It's important to ensure they're choosing a wide variety of food, that the eating disorder is not driving their decisions, and that they're portioning appropriately. The next step might be begin to choose and plate a snack and a meal with parental supervision. So now we're just going up in volume. In addition, you want to monitor health markers closely. Any fluctuations in vital signs, in weight, in lab work may be a sign that they're not getting enough nutrition or that there's some other behavior going on. And it could be a sign of safe foods, underportioning. Maybe they're meeting their meal plan. On the surface, it looks like they're meeting their meal plan, 3 meals, 2 snacks. But if they're consistently choosing a low-calorie option, then it's not going to be a full meal plan. The next step might be begin to have unsupervised snacks, either at school or out with friends. Start with one unsupervised snack, perhaps a friend outing over the weekend, and you make sure that before this outing, you're planning what they're going to have, when they're going to have it, where they're going to have it, who they're going to have it with, and you're going to check in with them. Maybe before, during, and after, maybe just after, collaborate with them based on where they are in recovery, what makes sense, have some kind of monitoring system in place. So maybe initially it's that they're taking a FaceTime video with you and you're observing them with a friend, or maybe it's then moving into just take a photo of what you chose for yourself. And then maybe we're just going to check in after the outing. When you come home, how did it go? So check in with your teen, what makes the most sense, but there needs to be some kind of check-in and conversation and monitoring system in place. So there's accountability and follow through. You could also use something like Recovery Record, which is a recovery app that can be a great way for clinicians, teens, and parents to connect around the meal support step. Another step might be to have unsupervised lunches, typically at school. And from here, autonomy can feel quite natural. It just increases from there. And every step of the way, you've checked in with them. How's their decision making? Where's the eating disorder showing up? Are they engaging in behaviors? Are they still medically stable? So on and so forth. And you might find that you move through phase 2 rather quickly, and you might find that you stay in partial autonomy for a period of time. Maybe they're good with their decision making, but they're really struggling with portioning or unsupervised snacks. So it's a process. It can take several weeks. It can take several months. It really depends on your teen and their recovery. But importantly, you want to support. You also want to think about autonomy with supervision as needed with compensatory behaviors. So if your teen struggled with purging or excessive exercise or any other kind of compensatory behavior, most likely you are monitoring them before or after meals and providing support. And when they're ready, you can decrease supervision in this area as well. And again, start gradually. If you were going from supervising 2 hours after every meal and snack, then you decrease that to 1 hour, to 30 minutes, to 15 minutes, to none, and so on and so forth. It's very important to be talking to your teenager about their urges and thoughts and their behaviors. You want to praise them for moments when they come to talk to you about any behavior that they engaged in. This is really important. So you gave them autonomy. They engaged in a behavior. They came and talked to you about it. Praise them. It's a little counterintuitive, right? Because we don't want them to engage in eating disorder behaviors. We're going to hold that frame. We don't want them to engage in eating disorder behaviors. But the very fact that they didn't keep that secret or hidden, they approached you and they wanted to be honest with you about it and maybe even troubleshoot, like, how do I handle this next time when it comes up? That's what we're looking for. Initiative, accountability, and honesty. Whenever we decrease any kind of structure, we should assume eating disorder behaviors and thoughts will show up. Because that's kind of how eating disorders work, right? They're looking at every opportunity to kind of come back, and it's a long-standing behavior, and we've only been in recovery for a short period of time, so we can't expect our brains to automatically be wired, right? Neuroplasticity is amazing, and it will happen over time, but it may not have happened yet. So your praise is important. We want them to be able to seek support, ask for help, access coping skills, and approach these challenging situations in a different way. And ideally, if they are seeking support from you before acting on an urge, that's a really good sign that they're ready for the next phase of autonomy. With autonomy, we have to be flexible, we have to experiment. Encourage your child to experiment with different kinds of foods and eating behaviors. Emphasize flexibility and curiosity rather than being rigid. Celebrate those small victories and encourage resilience in the face of any challenges or setbacks. So importantly, we want to stay neutral and non-reactive to any kind of setbacks, and these are our opportunities to troubleshoot. So have a frame of we expect them, they may come up. How are we going to navigate them when they do? And we really want to encourage open communication and honesty. And as I mentioned before, when autonomy is increased and structure is decreased, there's automatically more opportunity for the eating disorder to show up. And as a result, teens typically experience an increase in urges and thoughts in these phases. It's expected. It's not a setback. What's most important here is how do they handle it? They may struggle to share about these thoughts and urges for fear of more setbacks or losing autonomy. I think this is really common in teens. If I tell my mom that I've had my urges to restrict and she just allowed me to have unsupervised lunches at school, she's going to take that away. So they keep it hidden. And so before we get to this phase, you need to communicate with your teen that honesty and openness, especially when they're struggling and having urges, is actually what's going to promote increased autonomy rather than losing it, because it's a sign that they're taking initiative, that they're aware of their eating disorder thoughts and urges, that they're accessing some dialogue and making decisions about how to navigate it. That's what we're looking for in phase 2. We don't expect them to just be able to practice autonomy and independence and not engage in any eating disorder behaviors. It's this process of learning and navigating, and you really want to support them every step of the way. Now, you need to gauge how capable they are, and if they're engaging in active restriction many times and maybe losing weight, like clearly they are not ready for autonomy, and so you want to take that back. But if it's once or twice and they're coming to you and you're troubleshooting and you're seeing those signs of progress every step of the way, then let's keep doing it. You get to hold that level of uncertainty as long as there's progression. So you have to discern when you're in a regression or a plateau, and then identify when to step in. So have regular check-ins. Always be talking about their experiences and challenges. Listen to their concerns. Offer guidance and reassurance as needed. These check-ins provide an opportunity to address any difficulties, make adjustments, and you're going to be making adjustments every step of the way. So when you increase autonomy, always check in about how it went. Offer some opportunity to troubleshoot if there were challenges. Give them another opportunity before taking that autonomy away. And then if they're not able to follow through again, maybe you step back in. So it should be a dialogue, and there should be some collaboration around it, but always gauge your teen's motivation, insight, and judgment. Over time, you will gradually withdraw monitoring. So as they demonstrate increased autonomy, confidence in their eating, you get to pull back on your directive role, and you get to increase your trust in your child to make responsible choices while remaining available for support and guidance whenever needed. And that's essentially it. That's phase 2. It's all about increased independence and parents moving into a supportive role rather than a directive role. When your teen is struggling with autonomy, we recommend going back to the last thing that worked. And sometimes this might be meal support, so stepping back in to control meals or supervise lunch at school. Other times it may be more emotional support. You're going to support them in having autonomy, but you need to create more structure around it. So maybe they still get to go out with their friends, but now you're enlisting friend's mom to support at meals. Or you're going over to the sleepover to have snack with them instead of them being able to have snack there, but they still get to go to the sleepover. So whatever those decisions are, make them. But importantly, if your teen is struggling, don't wait too long to step back in, because the longer an eating disorder has opportunity to further cement itself in your teen's brain, it will take that opportunity. And so we do need to be vigilant during this phase, but you also need to support your teen's ongoing development and recovery. So positively reinforce what works. Go back to the last thing that worked when you need to step in, and always be focusing on externalizing the eating disorder. Differentiating when is your teen present and advocating for autonomy and independence, and when is the eating disorder present and advocating to stay sick. Remember that what happens is simply feedback, not failure. This phase is often more challenging for some families than phase 1. It requires a lot of communication and management of uncertainty. And so work really closely with your teen and with your clinicians every step of the way. Stay tuned. Next up, we're going to be talking about phase 3. And if you're interested in subscribing to our channel, you'll have access to whenever we release new content, or please head on over to our website and access our newsletter. We have many, many articles that can also support you in your recovery journey. Thanks, and see you next time.